Self-care is about patients taking a far more active role in their healthcare. Using tried and tested tools and techniques, the GP and the patient work together to empower the patient to look after their own health and to learn to recognise and manage certain symptoms themselves. Surgery time can then be used more productively, use of prescriptions and antibiotics can be reduced, and patients are often able to treat themselves without the delay or inconvenience of an appointment.
Self-care is about making better decisions about your health, and for that people need the right information, knowledge and skills and the confidence. Conditions and symptoms which are suitable for self-care include minor illnesses like coughs and colds, headaches, sprains or acute backache, and also more chronic conditions like diabetes, high blood pressure, asthma and COPD.
Self-management by patients of the condition is part of the prescribing module, and it's an area we identified where we are probably still weaker than we should be. For chronic conditions such as asthma and diabetes and indeed some other conditions, giving patient clear guidance as to how to modify their medication has a number of benefits. It gives the patient control of the disease, it gives them a better sense of being involved in their illness, of not simply being a passenger in the process. And there's good evidence that generally they use the systems well. The big difficulty is the time involved in trying to educate them, in trying to get the mind shift away for some patients whereby they still see us as being here to solve their problems for them. And it is an area that Productus has allowed us to look at again and to re-energise that process, and particularly with asthma, which is an area we've identified we want to focus on, in trying to involve patients much more with self-management plans to allow us to step down medication more effectively and hopefully therefore to develop good asthma control at fewer drug costs but with happier patients. So it's a win all round.
If we can support our patients in developing their own triage and understanding when they could benefit from coming to see us and when they don't need to see us, that will give us time to unpick the more complicated problems and support those more frail and more needy patients that really will benefit from our attention.
Even in the case of long-term conditions, you do find there's quite a big component of the condition that can be managed by patients, carers and their families themselves. And you only need the intervention of a healthcare professional for part of the condition.
I think there are a whole host of organisations and people there ready to support patients with long-term conditions to make better decisions about their health and their care, to self-care and to access healthcare support in a much more innovative and empowering way. So organisations such as Arthritis Care, who we've worked closely with, such as Diabetes UK, the Alzheimer's Society, the British Lung Foundation, are there already with people on a help desk to help patients with those long-term conditions manage their health. And we make the mistake in healthcare to think as GPs and primary care clinical teams or as specialists, we need to do all the work ourselves. We don't.
We've been commissioning research since 1987 into what people think and do about their everyday healthcare. There are 57 million consultations a year for minor illness in general practice, and 51.4 million of those were for minor illness alone. And in the consultation, we discovered that 90% of them ended with a prescription. By giving them a prescription at the end of the consultation, this just perpetuated the cycle of thinking that only the GP could sort their symptoms out for them. The cost of these consultations is £2 billion. The most expensive element of it is the GP's time, which is at £1.6 billion, but the cost of the prescription is around £400 million. But interestingly enough, we also discovered that 80% of those prescriptions were written for ingredients that people could have bought over the counter.
To implement a culture of self-care in the practice, the first thing is to talk about this at every opportunity in practice meetings, with receptionists, with practice nurses and with the wider team. Once everyone's on board with this, it's important to use opportunities to make information about self-care available to patients, which might include messages on the answer phone, notices on practice notice boards, on the website, and indeed in every consultation. Doctors and nurses can print out what's already been referred to as an information prescription, which is about giving information about the health problem, how long it may last, what the treatment options are, and where people can find additional sources for support.
If you give information, then that's for the next time, then the patient knows, there's no need to come and see this because I know this now, because I got that information last time. And it's very useful if particularly we've shared the red flags with our patients, because we can know when they do need to consult as well as they don't need to consult.
We've started to use information prescriptions with our COPD patients and gave them information about how to manage exacerbations appropriately and what to do if they get worse. As part of that, we issued them with rescue packs with steroids and antibiotics. And so far the response has been great because people felt much more involved in their care and felt more confident in dealing with certain problems themselves.
Patient education is an important part of self-care, and the Educational Expert Patient Programme aims to offer formal training in self-management skills for patients with long-term conditions. Some surgeries are also looking at how the scope of their patient participation group can be expanded to include patient education.
We hope to set up event evenings through the patient participation group, inviting specialists and charities in so people with chronic disease can come in, talk about it and benefit from advice. If we can provide them with education on simple things like a common cold and the best remedies that you can do for yourself, for self-care, then it prevents them coming into the surgery and taking appointments that they don't necessarily need. And I think it's empowerment for patients.
For me, the real cultural change is to just meet patients where they are, to meet them by telephone in their own home, to help them manage their long-term condition themselves, to support them to make good decisions about their health and about their treatment options. And really it's about a different conversation, a different way of interacting with our patients, and is about a much more adult-to-adult relationship.
The most important thing for patients is to feel cared for, and if they know that you're caring for them by giving them an information prescription, giving them the knowledge, the tools they need to be able to self-care better, they're more than happy. And in fact it's a wonderful feeling because you know that you haven't just sorted out the problem here and now, you've actually helped somebody take control over their life.